Hello, my name is Brandon McKee. I'm a healthcare communications manager and I'm here to discuss diabetes in youth. In today's objectives, I want to discuss the awareness for diabetes in youth between the ages of 12 and 18, education and symptoms to look for, and provide solutions for prevention of diabetes in adolescents. So what is diabetes? Well, diabetes is a chronic health condition that affects how your body breaks down food into energy. So the body needs insulin to help turn sugar or glucose into the food that you eat. So without that insulin from the pancreas to combat that sugar, the sugar in your blood is too high, causing various health issues such as heart and blood vessel disease, nerve and kidney damage, vision loss, and osteoporosis. So there are two types of diabetes found in youth. Type 1, which is a condition where your body no longer produces the insulin that it needs and you have to give yourself injections. It's a macrovascular disease that impacts the larger blood vessels in your body, including major arteries such as the coronary artery, the aorta, and the sizable arteries that are found in your brain and extremities. And also the most common type of diabetes in youth. Type 2 is the most common diabetes in adults. It's a disease where your body produces insulin, but it doesn't produce enough insulin to lower your blood sugar when you eat food. And the statistics about diabetes in youth is that 1 in 5 adolescents are at risk or have shown signs of prediabetes. And around 210,000 youth every year in the United States have been diagnosed with either type 1 or type 2 diabetes. And you can see on the graph that over the past 15 years, the people that have been diagnosed with diabetes has rose significantly every single year. And diabetes is the 7th leading cause of death in the United States, with having 85,000 people die every year, and about 270,000 people have mentions of diabetes on their death certificates. And so when a lot of people have diabetes, it costs a lot of money. So there's an annual $327 billion spent on medication and medical treatment for diabetes. With the average cost of a person, the medical expenses they incur is about $16,000 annually to treat their disease. So if you're diagnosed with diabetes, managing that disease is very important. It requires dedication and a very strict daily regimen. So what happens is when you eat food, your body turns that food into glucose. And without your pancreas delivering insulin, you have to give yourself insulin shots because your body no longer produces that insulin or not enough. So every time you eat, you have to check your blood sugar by pricking your finger. And then after you determine how high your blood sugar is, you have to give yourself an insulin injection. You also have to watch what you eat and count every intake into your body. You have to go to nutrition counseling, doctor visits often to see how much of a dose of insulin that you're going to require to make sure that everything is going well. And then also you have to pay for the medication and the test strips and all the equipment that goes into it, which is very expensive. Insulin prescription cost without insurance is around $450 a vial. And that is 1 month's supply that you have to get refilled every single month. So with like any disease, if left untreated, it can cause severe consequences, and diabetes is no different. So if diabetes goes untreated, it leaves high blood sugar in the various cells and organs in the body and leads to complications such as kidney damage that can lead to dialysis, eye problems that can lead to being blind, and increased risk for heart disease and stroke. And even sometimes it can lead to death. And when you see people that have amputated extremities, such as their arms, their hands, or their feet, it's often that they're diabetic and they don't take care of themselves, and their hands and those nerves in their body die, and they have to be amputated. So by not abiding by that strict regimen can really cause some serious medical conditions. So since diabetes is such a terrible disease and requires such a strict regimen to follow, awareness needs to be brought to the community, to the parents, to the kids in these areas that are impacted by diabetes. And so one of the solutions is to have education for the school systems that can be sent out to the parents and the community about risk factors, about treatment options, symptoms, and preventative techniques. Similar to what they do on Drug Week. They have Say No to Drugs, and they make this whole week about not to use drugs and things like that. So there needs to be something similar with diabetes. Posters with symptoms to look for, such as, frequent urination and extreme thirst and hunger, unintentional weight loss and fatigue. A lot of people don't know what to look for, so they can't get diagnosed early, and then it causes further complications. Also, a social media approach, is always good, with testimonials about people that have diabetes and are diabetic, and just to bring that awareness up that this is a serious medical condition and that it needs to be treated as such. And then also healthcare counseling. Need to bring in professionals to talk about health tips, at school functions and things like that, and treatment if they are diagnosed with diabetes. Because the more education that you know about it, the more that you are aware, and it can be prevented in the future. So the CDC has a program called Diabetes Prevention Program, and it reported that people who participate in this program experienced a 58% reduced risk of prediabetes. So people go in there and they have been diagnosed with prediabetes and are at high risk, and then they go through the program and they speak with educators, nutritionists, and healthcare professionals to give them guidance on how to prevent their diabetes. And it actually, by raising awareness, it decreased the risk of people getting diabetes. So to close, education and awareness will help reduce diabetes in youth while lowering the medical costs that are incurred by the United States economy. And by preventing and raising awareness for youth diabetes, we can improve the quality of life. There's a quote from Patch Adams that says, the purpose of a doctor or any human in general should not be to simply delay death of the patient, but to increase the person's quality of life. Because that's what it's all about, is having, not just living, but having a quality of life. Thank you for listening to my presentation. I hope that you have a wonderful day. Anybody have any questions?